Hello friends. Today, we will discuss a topic that we might frequently encounter in our lives without realizing it, but one we may not know enough about. Obsessive-Compulsive Personality Disorder, or OCPD for short. What is this personality disorder? What are its symptoms? Is it treatable? And what is it like to live with someone who has this disorder? I will answer all these questions with examples from daily life to make the topic more understandable. If you're curious about this or think someone around you might have it, this video is just for you. If you're ready, let's get started. First of all, what is OCPD? OCPD is a personality disorder where a person has a rigid, perfectionistic, and control-oriented thought pattern. For these individuals, everything must adhere to rules, order, and a perfect standard. However, this often makes their lives more difficult rather than easier. For example, instead of finishing a task, they may spend hours on the same detail, constantly thinking, "Can this be better?" This delays their work and can be exhausting for those around them. The main symptoms of OCPD include excessive orderliness, perfectionism, a need for control, lack of flexibility, and impaired functioning. Excessive orderliness can manifest in all areas of their life. For example, they might believe that items on a desk should be arranged in a specific order and feel significant discomfort if this order is disturbed. Perfectionism causes them to tolerate no mistakes in their work, leading them to constantly try to correct things rather than complete tasks. The need for control becomes apparent in both their own lives and the behavior of those around them. They need everything to proceed according to a plan, and deviations from this plan can cause them anxiety. Lack of flexibility makes it difficult for them to adapt to changing circumstances. For example, while a postponed or cancelled plan might be a minor issue for most people, someone with OCPD might struggle to accept this change, causing them serious stress. Impaired functioning means that these traits negatively affect their daily life and relationships. OCPD can look different in different people. Some may focus on cleanliness and order, while others might be obsessed with rules and control. Some individuals are overly sensitive about organization, while others are rigid about compliance. Therefore, when trying to understand OCPD, it's essential to consider each person's unique traits. OCPD can sometimes be mistaken for other conditions, especially obsessive-compulsive disorder, OCD. However, these two conditions are different. In OCD, individuals have recurring obsessions, thoughts, and compulsions, behaviors. For instance, someone might repeatedly wash their hands, thinking they are dirty. In OCPD, personality traits and behavior patterns are more prominent. Individuals with OCPD adhere to rules and order, but this adherence doesn't manifest as an obsession or compulsion. For example, in OCD, a person might repeatedly check if the door is locked, while in OCPD, a person emphasizes the rule that the door should be locked and the importance of this rule. This difference is crucial in distinguishing between the two conditions. Another condition that might be confused with OCPD is narcissistic personality disorder. Individuals with narcissistic personality disorder also value high standards and perfection, but typically for the sake of admiration from others. In OCPD, perfectionism is based on the person's internal standards and is about adhering to their own rules rather than seeking approval from others. So, how should people around someone with OCPD behave? First, it's very important to be patient. Individuals with OCPD might seem challenging to those around them due to their perfectionistic and control-oriented behaviors. However, understanding the anxiety underlying these behaviors can help establish a healthier balance in relationships. Being supportive and trying to understand them can make these individuals feel safer. Additionally, it's important to avoid criticism. For example, instead of criticizing their meticulousness or perfectionism in doing something, try to understand that these behaviors are their way of achieving inner peace. However, it's also crucial to set clear boundaries. While respecting their need for order, you should not neglect your own needs. Imagine trying to watch a movie with someone who constantly pauses to adjust the volume or the picture quality. This behavior stems from their internal unrest, not a desire to criticize you. Similarly, while planning a vacation, instead of enjoying it, they might constantly worry about details like, is everything okay? Are the reservations correct? Is there anything missing in our schedule? This can be exhausting for both themselves and those around them. So, what are the causes of this condition? Research indicates that both genetic and environmental factors can play a role. Individuals who grow up in overly disciplined, critical, or controlling environments during childhood are at higher risk of developing this disorder. Also, it is more common than generally believed. According to research, about 2–8% of the general population exhibits symptoms of OCPD. Therefore, the likelihood of having someone with these traits around you is quite high. Finally, let's discuss the challenges of living with someone who has OCPD. Living with a person who has OCPD can be both challenging and instructive. These individuals may set high standards for those around them. For example, they might think you are not being careful enough when doing a task and constantly intervene. However, it is not correct to think they do this intentionally. They behave this way to feel safe. Therefore, it's very important to be patient and supportive. If you think you have this disorder or someone around you does, don't hesitate to seek professional help from a specialist. Thank you for watching this video. If you want to see more content like this, don't forget to subscribe to my channel and like this video.